can't believe this. We've always been so healthy.
It's entirely my fault. I should have had insurance.
Don't blame yourself. We had no way of knowing you were going to have a heart attack. I mean, it's been hard times. You were laid off, out of work, and no insurance. Many Americans are experiencing this. Let me try calling the insurance company. It's our last hope. Hi. Yes. I want to see if we can apply for health insurance. Uh-huh. Yeah. Well, my husband did. He had a pre-existing heart condition. He's fine now, though. Please, I'm begging you. We really need this.
So what's the news?
We were denied again. Let me try searching the web one last time for insurance. Our current system has many flaws and many benefits at hand. The flaws at hand are very great. According to Bookings, Improving Quality and Value in the U.S. Healthcare System by Neil Brennan, there are approximately 46 million Americans who are uninsured. And on the many insured Americans who face rapid increase in premiums and out-of-pocket cost, flaws within the system are our insurance companies are currently finding loopholes to drop patients whenever their illness becomes too expensive. Insurance companies are also able to deny families of coverage for pre-existing illnesses. Many of these families aren't trying to take advantage of the system, but simply want equal opportunity to get coverage. Healthcareprogram.org states the amount of people pay for health insurance increased 30% from 2001 to 2005, while income for the same period of time only increased 3%. This makes it difficult for lower income and middle class citizens to afford health care. Here are some benefits with our current health system. You can choose your own doctor, which gives you many options. Some say there's shorter waiting times with the current insurance. The patient also has the right to choose the facility they want to go to. We also have the option to be covered with other services, such as dental, vision, nutrition, and chiropractic services. U.S. citizens may never have to worry about being approved or denied for insurance ever again with Obamacare, also known as the Affordable Care Act. Every system has its benefits and flaws. Employers are talking about dropping family and only insuring the employee. This leaves the employee having to pay for coverage for the whole family. Another flaw in the system is that Obamacare claims that it will fine families if they do not have insurance, when they can barely afford the basic essential. How are families supposed to pay this fine when they can't even afford the insurance price? According to DC Decoder by Catherine Jacobson in 2014, the fine for uninsured is $95 per person, up to a family maximum of $285, or 1% of family income, whichever is greater. But the penalty will increase more than sevenfold in the next 2 years, with the fine running as much as $695 per person by 2016. Some benefits of the Affordable Care Act are every person, even with a pre-existing disease, will have access to insurance. This will help cut the power of the private insurance companies and force them to make changes. Every person will have equal opportunity to treatment, but will probably have to go through a drawn-out process of having to go to facilities that only accept the Affordable Care Act insurance. Another benefit is this will open up more jobs for the medical field. Since everyone will have insurance, medical facilities will have to hire more employees to handle the volume of patients. According to Yahoo News by Amy Hurt and Dorothy Wax, California Healthcare Foundation 2011 reports titled Primary Care Everywhere The act will bring a surge in demand primary care, which could mean increased demand for medical assistance. I don't think we'll find any answers to what's wrong and right. But one thing I do agree with is that everyone should have equal opportunity to be approved by insurance if they choose that they want health care. Uh-huh. Yes. Well, my husband did have a pre-existing heart condition. Really? Oh my gosh, it's the best news yet. Okay, thanks. All right, bye. Thank you.
What did they say?
We have insurance.
Yes!